DataCare project, an electronic medical record system. Poor health information has been identified as a major challenge within the African community. Most hospitals continue to use the paper-based system, which is costly, requires huge storage, and there's lack of backups. Most patients tend to have files in different hospitals and have no idea or access to a complete health history. Health professionals have to guess a patient health history, which may result in wrong diagnosis or duplicate tests or medical errors, leading to severe illness or even death. Doctors who are unable or do not treat patients within the set standard are not identified or monitored, as they could not track their performance could not be tracked, or services they offer cannot be tracked, as there are no often incentives. The increase in medical negligence or legal cases as a result of low quality healthcare services, which are leading to high mortality and morbidity rate within several health facilities in the African community due to lack of accountability. There's limited healthcare database within many developing countries, as there are no tools to measure the community health status or health outcome. It makes it difficult to identify the prevalence of disease, the demographic characteristics of the population, or even the healthcare provider performance analysis. So, with my team, we came up with an electronic medical record system. This is a digital platform or database that will enable healthcare providers to have quick access to patients' accurate and complete health records using a phone and a unique number. Some of the features of this design or prototype include an automated voice system, which would help to store or which would help a doctor to access or store patient health history. There's also a text messaging system that would help send reminders and patient information to patients. This design also creates a chart or a graph from patient medical history to help assess their health improvement rate. And also the database can be used to monitor a population health status. As you can see, this is a cloud-based system. So this is a brief overview about the process or the structure of our design. So when a patient visits a clinic, they may carry with them an object or a card which has a unique number. And then the doctor will dial this unique number on an analog phone. And then an automated message comes up for the patient to identify, for the patient to verify their identity, either using their name or date of birth, which would be followed by their patient health history. The doctor will then record his or her diagnosis as a voice message which goes on to the cloud. This feature also uses a voice-to-text system that translates the information onto the cloud and stores this data. This is a demonstration about of how our medical record system would look like. So this is a login where the healthcare administrator will log into the system with their information. It will show the patient's name, the date they visited the hospital, their diagnosis, the treatment they were given. When a baby visits the hospital, because the baby do not have a phone or their unique number, they are mostly added up onto their parent. And so you could see from one of the files that they are initials of the patient. And yeah, this is a brief overview of how our system would look like. And this is the coding that was done by my colleague using the Linus system. I could not talk much. I cannot talk much about this coding as I have little idea about the coding aspect, but I am sure it will give you a broader idea about how this whole system or this whole design was created. And so you will ask, what is so special about this design? Yeah, our DataCare product is easy to use and less costly as it does not depend on constant electricity and internet as you use the analog phone. There's no room for medical negligence as your dates and information are being recorded and also sent on a cloud, and also this system can be used in an emergency or ambulatory care. So these are my team members that I work with. Thank you everyone for watching.